Thank you so much for joining us on this Monday for our only press briefing of the week, this being Christmas week. Happy holidays to you all. Today, Mayor Demings will discuss our goals for the week and give an update on our county COVID-19 numbers, positivity rates, and details on antigen testing in Barnett Park. The mayor will also provide details on CARES Act funding and the work of our strike teams, which seek to gain compliance in commercial safety in many of our restaurants and other venues. The mayor will also go into his mailbag with some letters from the public during this pandemic. Dr. Raul Pino from the Florida Department of Health in Orange County is here as well with his in-depth analysis of the pandemic in Orange County. We begin with Mayor Demings. Mayor?
Good afternoon and welcome to this press briefing. I think we're up to probably about number 96 and 97 since the pandemic began, but this will be the only press briefing for this week. I didn't believe that people wanted to hear about this type of news on Christmas Eve and Christmas, so we're going to give them a little bit of a break and kind of focus on the uplifting season that we're in at this point. So I hope that you all don't mind the fact that you won't be here on Christmas Eve or Christmas. But before we begin, I want to commend our Orange County Fire Rescue Department and Chief James Fitzgerald and his team for recruiting the most diverse class of recruits in the history of the Orange County Fire Rescue Department, class number 91. I had the opportunity earlier today to participate in an event at the training center. We have 65 new brave souls who want to be firefighter, EMTs, and paramedics with Orange County. And we are glad that during this period in which these are extraordinary times for all of us, but certainly for those who are frontline workers, the healthcare workers, and the first responders, during a time when people would perhaps run away from danger, we still have some individuals who want to run to it and become firefighters. It's a historic class because 19 of the 65 individuals are women. And with the 19 new women that will come on board, it will make about 9%, I believe it is, of our fire department female. And of this class, about 50% of the individuals who have been recruited are ethnic minorities. And when we think about that during this period of time, we had to do recruitment to get 65 during the period of a pandemic itself. And so again, I say kudos to our group. Many of your stations participated in an earlier event today. The campaign that we had underway during the spring was called hashtag Go Beyond Recruitment Campaign. Again, it happened in a number of ways, but we were using social media platforms, Zoom platforms to interview many of the candidates, et cetera. So now, as we transition, let me talk a little bit our goals for this week. We are yet at another week, and Dr. Pino lose track of the number of weeks that we have been under a state of emergency. But my goals continue to really focus on stopping the spread of the virus within our community. With that, we will continue to offer free COVID-19 testing through Orange County Health Services at Barnett Park, at least through January. The state will continue free testing at the Convention Center site, at least through the first quarter of 2021. Our strike teams will continue to inspect and work with Orange County businesses so they are in compliance with CDC pandemic standards. And we will continue to provide an update to all of you about how we're doing with the distribution of the vaccine within Orange County. You're going to hear some numbers in just a few moments about that. In terms of where we are right now, today in our county, since the pandemic began, we have a cumulative number of 69,491 cases in Orange County. Never thought we'd get to that number. as we approach 70,000. I know that before this week is over, we will likely get up to probably 72,000. 633 cases were reported yesterday alone. Our rolling average for the 14-day positivity rate is 9.6%, up from 8.4% at our last briefing on Thursday of last week. A reported 717 Orange County residents have died as a result of the coronavirus. I pause there because I know that's significant for a lot of families here. That's an increase of 20 deaths since Thursday of last week. So our hearts and prayers go out to those families, especially during this Yuletide season. Dr. Pino will share more details, but so far he has shared with me that 5,461 people have been vaccinated in Orange County in the past 6 days. It's a start with a population of 1.4 million people. It's a start. Orange County Health Services free COVID testing, again, will continue for the foreseeable future. Over the past week, due to the high demand, we have had to turn some of our residents away on the day that they went to the park. During our early afternoon hours, we have had to close the lines as early as 1:30 p.m. because of the demand. Our residents are likely getting tested as they prepare to travel and or participate in family gatherings for Christmas. From Friday through Sunday, Orange County Health Services administered 4,437 tests at Barnett Park alone. Many of the places where people are traveling to require testing results to be made known. The site will be closed on Christmas Eve and Christmas, Thursday and Friday. However, it will reopen on Saturday. For more information, you can go to our website at ocfl.net/testing. As we prepare for the end of this round of the CARES Act funding, remember we had until December the 30th to spend the $243.2 million that the federal government provided to our community. I want to give you an update on what we were able to accomplish during that period of time. Over $14 million in CARES Act funding has been paid out so far for social service programs to help some of our most vulnerable residents. With the added stress of the pandemic, we provided for 89,000 plus counseling visits for mental health services offered through various agencies. We also find that many families were in need of food, basic necessities like food. Nonprofits such as Second Harvest Food Bank have received funding that has resulted in over 5.8 million meals served during the pandemic. In addition, the monies have helped to house 161 homeless individuals and families and have kept another 238 families or individuals from becoming homeless because of our eviction diversion program. We are hoping that lawmakers in our nation's capital will send additional funding our way so we can continue to make a difference in the lives of our residents. If you need more information on our social services and the programs offered as a direct result of the CARES Act funding, you can go to our website at ocfl.net/resident resources for more information. In order to contain and control the virus within our community, we've had to have a piece of accountability. And we've done that by having the compliance of the strike teams. So I'm going to provide you an update about the work that they're doing. Since the team started back in August, they have visited nearly 6,000 locations. Overall compliance rates remain high at 98%. 728 follow-up inspections have been conducted. Since the executive order was issued earlier this month, the teams have now visited 406 businesses since that time and have issued 35 warnings and 8 citations. Again, the overwhelming majority of our businesses are compliant. I want to share with you, sometimes we get feedback about the work that we're doing, and I'll share some of the positive emails. And by the way, most of the emails that I receive are positive. These emails affirm that we are on the right track in trying to stop the spread of the coronavirus. I will read just portions of the emails. I think they're on the screen behind me. We had one email that said, "This pandemic has been difficult for all, and you have been concerned for the most vulnerable among us," from one of our residents. Another resident wrote, "Thank you for taking action." Another resident says, "I support your face coverings order, also the accountability you are holding our businesses to. It is efforts like these that are keeping our positive numbers and hospital stays to a minimum. It is also these efforts that allow hospitality industry workers to see improved occupancy over month over month." So let me just say this to you. I appreciate the team of individuals that I'm surrounded with, consummate professionals like Dr. Raul Pino from the Florida Department of Health, Scott Howard from Orange County Public Schools, Dr. Barbara Jenkins, the school superintendent, our healthcare advocates and hospitals here in the area. We have daily calls with Advent Health and Orlando Health and HCA in this community. Because of the talented team of healthcare experts here within Orange County, individuals like Dr. Yolanda Martinez, Dr. Zuver, and others who provide advice to me, we have been able to execute. The county administrator, Mr. Byron Brooks, and the team of staff, they've been able to execute. They've been able to get us to get the money out the door to assist our residents here in Orange County with that deadline that was always lurking of December the 30th. All of our residents in Orange County ought to be proud of the teamwork that has occurred across the various agencies. We have worked with the municipalities. Mayor Buddy Dyer could not be here today, but also been very supportive of the efforts that we have underway. And so as we approach Christmas this Thursday, Friday, as we approach that period of time, we want to remind people that please remember to minimize your gatherings. We want to come out of this post-holiday having managed the spread of the virus within our community. We cannot do that without the help of the people here in Orange County. So you're going to hear that message and that reminder from Dr. Pino, and I'm going to turn it over to him at this time. Dr. Pino.
Thank you, Mayor. Good afternoon, everyone. As the Mayor mentioned, our total numbers are accumulative, 69,491, with 717 deaths. And our condolences, we join the Mayor in offering our condolences to our community, their family members, and their friends for the lost. I actually lost someone very dear to me Saturday in Connecticut. She was one of what I call my original angels. Helped us a lot when we arrived from Cuba. A wonderful Puerto Rican that the entire Latino community in Connecticut owes a lot. Our recovery rate is 90%, and of the 20 deaths that we receive added to our roll, 17 have known conditions, 3 didn't have any conditions that we know at this point. 3 of those deaths were from August and September, 3 were from November, and 14 were from December. And that happens also last week too. The largest number was from this month. And that's an indication that our rates may be increasing. I'm going to give you some information on that. We also would like to inform the public that the Florida Department of Health has a website. It's https // I know that's common for everyone, but now the name is Florida Health COVID-19, 19 as the number. Florida Health COVID-19, 19 the number, all one word, .gov. And there you are going to find information about the draft plan for vaccination for the entire state. And there's also going to be data about the number of vaccines received or given by each of the counties. As the mayor mentioned, it has been reported so far that our county has given 5,486 dosage of vaccines. They are all Pfizer. And just to give you an idea, and this will pick up, 5,000 is not a significant number when you have 1.4 million people. But just to give you an idea, the first day that we vaccinated people, we vaccinated 14 people in our county. That was December 14th. December 15th, we vaccinated 987. December 16th, 1,153. And December 17th, 2,916. And it should go like this. It will be exponentially growing as vaccines are delivered and also the number of providers increase. Also, for the parents of our students, they will be going on vacation, or they are, and on break. And remember that you will not receive the letter for quarantine that you were accustomed to receive when the students were in class. Because the students are not in class, we don't have to quarantine classmates. And that was the objective every time that we found a positive individual on each of the schools. But that doesn't preclude the parents from taking steps and protecting their children when they engage in activities at large in the community. Last week, I spoke to you about, and actually it was one of the questions, and we didn't know about this paper, but the CDC recently released one of their reviews to confirm that all across the United States, transmissions are not happening in the school for school-age children. It's happening at home and parties. It's happening out in the community. So many of you will continue to receive those cases that are positive cases, will continue to receive our calls. But not all the cases that we are having every day will receive the calls the same day that we are receiving the case. The mayor just mentioned to you that yesterday we have over 600 cases. So we have started a couple of weeks back, and I mentioned it to you, to prioritize how we get to the cases. And we are going to concentrate in those in assisted living facilities, healthcare facilities, places that may be experiencing an outbreak. And then when we are finished with those cases, then we could move into the general population of isolated cases, which is a little bit different. Also, we are calling for volunteers. And in this case, we are calling for LPNs and medical assistants out in our community that may want to work some extra hours and probably get compensated for it. We will recruit additional people involved in vaccination. Again, you have to be licensed in the state of Florida to be able to provide these vaccines, and we are looking for LPNs and medical assistants. So you can send us an email, or you can go into our website, orange.floridahealth.gov, and apply as a volunteer. for those who are medical assistants and LPNs, we may be able to offer some level of compensation. As you know, has been released in the news, we will be receiving Moderna tomorrow. It's planned to receive tomorrow. We received today the shipment of the accessories that come with the vaccines. So we should receive the vaccines tomorrow. That will be Moderna, 16,000 dosage. And we are preparing to engage in vaccinating our EMS providers starting the 26th to the 31st, continues from Saturday, Sunday, until we get to the 31st, to be able to accomplish all our providers within those days. I'm concerned about some of the data, and I wanted to mention it to you, especially about long-term care facilities. From the prior week to the last week that just finished, we doubled the number of individuals with COVID-19 in long-term care facilities. Week 50, we ended up with 54 individuals. Last week, we ended up with 104 individuals in assisted living facilities. And this is where we get really concerned about mortality rate. With the hospitals, we will start reporting to you some hospital data as we monitor the performance of our health systems closely. Our total bed capacity last night was 4,819 beds. We have available last night 1,122, that is 23% of that inventory. That continues to be a healthy number of beds. We have 167 beds available in ICU. We have 678 ventilators on site, and 420 of those, which is 62%, are available for use. COVID-19 patients on beds last night, on ventilators, that is, 38 individuals. COVID in ICU total, ventilators and not in ventilators, 52. COVID-19 in non-ICUs, meaning general hospital, 256. And the total number of hospitalized people in our county for COVID-19 as of last night, 308. Now, if you look at those numbers, our system continued to perform very well. We still have inventory to be able to serve the needs of our community. But from the 19th to the 20th, we increased the number of hospitalized people by 30 overnight in one day. So that increase indicates, and this is the largest increase we have seen in a few days, but every day is really increasing and increasing and increasing the number of hospitalizations, although it's expected. It's not without fear that we look at this data. So please mask up, wash your hands, watch your distance. Do not have Christmas gatherings if you don't have to. And if you have to, please put some measures at home. Try not to mix households. Try to protect people who are 65 years and older with pre-existing conditions. With that, we'll answer any questions that you may have. Thank you.
Okay, we'll open it up at this time. If there's any Spanish-speaking media here, we have Ms. Carol Palacio, who is going to help translate for us today if there are questions for me in Spanish, and Dr. Pino is fluent. We also have Mr. Scott Howard from the Orange County Public Schools, who's present today, and other staff members are here if you have any questions about the information we have shared at this point. So with that, we'll open it up to any questions. And Lauren Seabrook.
Lauren Seabrook, Channel 9. Dr. Pino, in regards to long-term care facilities, do you have any indication of why those numbers are going up so much? And I think a lot of them expected to be getting the vaccine by now, so can you kind of tell us where they're at with that process for here in Orange County, and if you expected to see them getting it by now?
So the vaccine, I don't know. That's a fairly funded program through CVS and Walgreens. So that is happening outside of our domain to say, but we stand ready to help if we are asked to help. That's all that I know. Also, with regard to why, it's just a matter of time. meaning we were expecting this to happen, and I think that we alluded to this a few weeks back, that this could happen. And it takes about 3 to 4 weeks to move into that direction. And what is happening is moving older, and then we have the children, and now we have the parents of those children who were initially, and when I say children, I mean, up to college kids. And remember, we have the 21, the 22, 24, 25 group, and now has moved, the fastest growing group right now is that, and then 35 and older. And what is happening is, this is also the individuals that go and visit the grandparents and the social interaction that may be happening at these facilities. So it was just a matter of time.
Bob Hazen from West 2. For the people who have been vaccinated already, who have received the vaccine, has there been any indication of any kind of adverse effects or any kind of problems that have arisen for them?
Not that we are aware. Nothing major yet. Although, people go through a screening process when they are about to receive the vaccine. And again, those individuals that those individuals that carry an EpiPen, people with severe allergies, should not have the vaccine. That's the advice right now. And people who have any allergies should check for the content of the composition of the vaccine to see if they are allergic to any of the components. And it's always good to talk to your allergist or to your doctor, say, hey, can I get that vaccine? And get that, that clearance.
Buenas tardes, Félix Pirela de Telemundo por acá. Doctor Pino, quisiéramos saber cuál es el balance que ha arrojado los últimos 6 días en cuanto a la primera jornada de vacunación de Pfizer acá en el condado Orange y cuál sería el plan para esta semana de la distribución de las vacunas de Moderna.
Pues con la vacuna de Pfizer está siendo administrada inicialmente por los hospitales acá, producto del hecho de que tienen que controlar la temperatura tan cercanamente. Y hasta ahora más de 5,000 personas han recibido la vacuna. Esos números se van a incrementar potencialmente, exponencialmente. Nosotros vamos a tener días en que tal vez estemos vacunando 10,000 personas al día cuando esté todo generalizado. Con respecto a la vacuna Moderna que me preguntaste, debe llegar mañana en la mañana. Vamos a recibir 16,000 dosis en el Departamento de Salud. Otros proveedores también recibirán sus dosis. Las dosis que vienen para el Departamento de Salud están destinadas para los EMS providers y los law enforcement. Esos son los primeros grupos que vamos a atender. Yeah. So the question was, what are the plans for the Moderna distribution, and what are the numbers of people already vaccinated? I mentioned to you before the number was over 5,000. And with regard to the plans for Moderna, I explained that it will be arriving tomorrow at the health department. We are not the only ones receiving vaccines in the county. Other facilities and providers will be receiving vaccines as well. The one that we are receiving, it is allocated for EMS providers, first responders, and healthcare workers in the health department, and then we will move aggressively to other groups in the community.
Steve Hudak from the Orlando Sentinel. This is for Mayor Demings. You said at our last presser that if you received money from the CARES Act, whether it was for the eviction diversion program, for the individual and family assistance program, or from small businesses, please contact your congressman or congressperson to let them know that we would prefer a direct funding. It doesn't look like this first emergency bill will include that. Are you disappointed with that? And what are you saying at home?
I put a lot of pressure on my wife at home, no. But yeah, I was disappointed, but I still am hopeful because I don't think Congress is done at this point. We believe that there will be, after the first of the year, another allocation that would be dedicated to state and locals. So we're going to continue to advocate that we receive direct allocations because that allows us to react and respond to the needs of our community in a timely manner versus if the money is all distributed to the state and we have to depend upon the state to figure out how to redistribute it. You lose days, you lose time, and in many ways, the individuals and families, they need help right now. They can't wait days, weeks, months. They need help right now. So I know that if Congress reaches an agreement today, there will be some help on the way as soon as perhaps a couple of weeks, depending upon how and what that looks like. But that amount of funding that is presently in the relief package would not be adequate enough to sustain individuals and families for months. So very quickly, we will need to ensure that where that gap funding occurs, we're able to hopefully fill that gap from a direct allocation. I believe Dr. Pino would agree that we will be wearing masks, doing social distancing, and perhaps will not be fully recovered to an appreciable level until sometime early summer. So because of that, our small businesses are going to continue to struggle. If they struggle, families and individuals will continue to struggle. And we have to help through the creativity that we have demonstrated over time with the funds that we have been entrusted with. We have put the overwhelming majority of that money directly into the community to benefit our residents.
May I follow up with just one thing about this? The governor has done what I would say is probably a poor job of communicating with our county and some of the other counties in the central corridor here. Does that cause you heightened alarm or concern about whether or not Orange County will get a fair share?
You know, I trust that, you know, our elected leaders will do the right thing. And I'm going to use the bully pulpit of the public forum to ensure that Orange County gets its fair share. Okay.
Dr. Pino?
Yes.
Hey, Asher Wyman, Channel 13. Just one clarity, one question. I'm sorry, did you say 16,000 or 60,000 Moderna?
16.
16, okay. And then the follow-up question to that is, can you talk about the teaching you'll be asking nurses or what you're going to be offering nurses and LPNs that are going to volunteer, kind of what goes into their responsibilities or training that you'll need from them? And also, where you hope to find them?
Where?
Where you hope to find them?
So, you know, there are many LPNs, medical assistant, nurses that work in multiple locations, and they have some time off. Some people may want to help. A lot of volunteer has applied to be accepted. Of course, they have to go through background checks because they will be having access to, generally don't, but they could have the ability to have access to some data sets, so that has to be clear. And also, they will be fingerprinted for criminal records. And they will all receive a on-site training about vaccinating, just to be sure that everyone is up to speed with the techniques and what to do with this vaccine, what dosage you need, how you provide the vaccine. And it's also some small training on how we collect the data that, thanks to the county, we may be able to automate the entire process of collecting the data for the vaccination, which is going to speed everything up. The idea is that there are some individuals out there that may need some resources that we have, and they can help the community at the same time. So it's just a match made in heaven. The idea is that what we want to recruit volunteers from the community is that we are going to be on this one for months until we get up to 79 of our county vaccinated. That's over 100,000 people. So I want to have enough personnel that we can give breaks to our employees and to everyone so that we don't burn our people at a fast pace that this may require.
This next question was texted in from Mayor Demings and for Dr. Pino from Eric Sandoval with WKMG. The question reads, what kind of assistance are you looking for as Congress prepares to vote on a possible stimulus plan tonight? What can the federal government do to help your individual agencies?
I've tried to be clear that I want the federal government to provide direct allocations to our local governments so that we have the ability to continue offering testing. We have the ability to continue offering assistance for eviction diversion. We have the ability to continue offering assistance to small businesses and perhaps where we have the ability to continue helping to fill the gap for financial crisis assistance to our families and individuals in our community. If we have the flexibility with any new round of relief, it gives us the opportunity to be on the ground to where we're most familiar with the people who live in this community than any other division of government. And so if we have the ability, because we're most familiar with our residents, I think that we could be effective at ensuring that the funds get spent in the most appropriate way possible. I realize that the federal government has guidelines and criteria for expending the federal dollars, but we have been able to meet all of those guidelines, and I believe that the residents of our county would agree, I hope, that when we've been able to do some of the creative things that we've done here, that they saw government at its finest.
So we don't receive allocations like that because it's all come from the state for us, as we are an entity of the state, but we benefit when the county receive direct allocation. Was the same in this round that recently the county received, and we were able to access some funds. But for us, it's all about flexibility, the ability to be flexible how the money gets spent, because not everyone has the same needs.
Thank you. This next question was texted in from Roy O'Neill with iHeartRadio from Mayor Demings. Mayor Demings, is there any concern about British tourists still being allowed to travel to Orlando?
That's probably more of questions for an epidemiologist, and so I'm going to lateral that one to Dr. Pino.
So the analysis that determined the mutation, if you want to call it somehow, of this virus was done retrospectively. So that data was found to be on cases that already happened, so they realized. So with that, what I'm trying to say is that although everyone is trying to stop how this new stream may spread across the world, it could be already across the world, because it's not a case that was identified yesterday. So this had happened. So it's safe to assume that it has spread to some places already. It's also important to know that the vaccines that are in place will continue to be effective, even against that one. But the best vaccine that we have for any virus is this one. It's just any. And this may be the reason why the flu season has not been as bad as always around this time. We are actually pleasantly surprised how low our flu season has been this season. Although the flu goes up and down, we think that the use of the mask has had an impact in flu transmission as well. So it is important to continue to wear your mask. And please do not trust the vaccine yet, because the vaccine, as we are going to implement it, will not have an effect on the pandemic right away. it probably will have an effect first in death rates. And that's the intended objective, to decrease the number of people who are getting gravely ill and dying from this disease. That's going to be the first effect that we are going to see on the vaccine, because of who is receiving it first. It will not have an impact in the large community numbers until we engage in mass vaccination. And that should not be until maybe late February, early March. So with that, we will continue to use masks. We have to continue to wash our distance, and we continue to wash our hands. That's the safest way to protect.
Dr. Pino, this next one is from Ryan Lynch in the Orlando Business Journal. His question reads, what % of the county population is expected to be vaccinated by the end of 2020? How quickly do you expect those efforts to ramp up in the new year?
So I don't know those projections really. It all depends how we speed up. But if we have 5,000 at the beginning in the first 72 hours or so that we have been doing this, and we are going to speed up, it is safe to assume that we could be doing about 10,000 vaccines a day when we get to fully speed, and maybe even more.
And then, Dr. Pino, this is your last one, then I have one for Mayor Demings. This is from Meg Turner with Night News. Dr. Pino, can you please elaborate on the COVID data analysis and how 366 cases were found to be UCF student cases between August and November? When students tested positive, are they advised to inform the university by the health department?
Could you repeat the question again?
I think she wants to know how the health department knew 366 cases were found to be UCF students, how the reporting happens.
I don't understand the question really. Just to say, the school was doing some testing, so it could have come from the school, so there's testing I have to identify. And sometimes the data contain if the person is a student and where they are. But we also, through trace investigation and contact, we know, and we also, remember, have 10 students at UCF that are volunteers tracers that are helping us with that data as well.
Thank you. And lastly, for Mayor Demings, this is from Melissa Thomas with Florida National News. Mayor Demings, when you were first elected, you shared your vision of making Orange County government and the connected agencies more diverse. After this news and more diverse firefighter class, what else does your vision for greater diversity entail?
Well, we have endeavored to really ensure that there's inclusion in terms of business and the different minority-owned businesses that we do business with as a government. But we're even looking to not just hire for diversity, but also through the MLK initiative that we began here, where we began to look at all of our various processes across the county's departments and divisions to see how we can make certain that the community reflects the diversity of our community and employ and the administration of our budget, et cetera. So we're going to continue to do this. This is a long-term effort that we have, and so diversifying the department, the fire department, and the other departments from corrections to others, we're going to get after it. So, thanks. All right, I believe that is the final question for today. Let me just say to everyone, Merry Christmas, Happy Holidays to all of you. And our next press briefing is scheduled for Monday, December the 28th. Thank you all for being here.